Okay, next up we have Jaclyn Bowen. She's a food safety and quality systems engineer and executive director of the Clean Label Project, which is a US-based national nonprofit and consumer advocacy organization that has the mission to bring truth and transparency to food and consumer product labeling. So Bowen was the researcher and co-author behind the largest academic peer-reviewed study ever conducted on lead and cadmium in baby food and infant formula, which was published in The Science of the Total Environment. So Jackie, to start off, can you please tell us about the mission of the Clean Label Project?
Sure. So, as you said, Angela, the mission of Clean Label Project is to bring truth and transparency to food and consumer product labeling. For the most part, when you look at the food safety regulatory fabric in America, it's primarily focused on microbial and pathogen contaminants, things like E. coli, Salmonella, Listeria, things that can contribute to vomiting, diarrhea, or worse within 24 to 72 hours. But when we're talking about things like industrial environmental contaminants, and especially like today, talking about things like heavy metals, the reality is that heavy metals can take years, even decades, to manifest themselves in chronic disease. So for us, it's one where it's not like the jury is out. There's very clear evidence that shows here's the long-term repercussions. Here's the impact of lead on the developing brain. Here's the impact of different types of, cadmium on the immune system. So it's one for us that even as we look at industrial environmental contaminants and specifically heavy metals, yes, heavy metals are naturally occurring in the Earth's crust that because of billions of years of volcanic forces resulted in the periodic table of elements. And there are certain heavy metals that are essential for life, things like zinc and iron. But at the same time, when it comes to heavy metals, human causes, mining, fracking, industrial agriculture, the use of wastewater for irrigation in the form of pollution can end up in the air, the water, and the soil, and ultimately in high levels, in the absence of federal regulations, ends up in contaminating food that is provided to the most vulnerable populations.
And your organization specifically offers a service.
That's correct. So for Clean Label Project, what we do is we have a certification program for those brands that are voluntarily opting into thinking about food safety differently. That it's one where you kind of have, the food safety focused primarily on pathogen contaminants, microbial contaminants. It's a matter of rethinking the way that you formulate food, rethinking about the way that you source ingredients, and that you proactively screen for high levels of heavy metals through proactive testing using, state-of-the-art technology, ICP-MS, mass spectrometry, those types of things, in order to proactively look to minimize. The reality is that we're never going to completely eliminate, but we can definitely do better when it comes to sourcing ingredients, formulating ingredients, especially when we're talking about vulnerable populations. The World Health Organization says that first 1,000 days of life from conception till the age of 2 is that primary period of time for optimum brain and immune system development. So for us, it's a matter of this is that critical window, really that is about proactively looking to start a good long life focused on health and wellness.
Thank you. Okay, so we've talked about this before. There's a new California baby food regulation, California Law AB 899, which newly requires manufacturers to test a representative sample for 4 key toxicants: arsenic, cadmium, lead, and mercury, and publish the results on their websites. So please tell us about the implications of this policy.
Sure. So California AB 899 is a new law that passed in California, but absolutely has national and quite frankly, international ramifications. So California AB 899 was passed in January 1st, 2024, requiring mandatory heavy metal testing on a lot-based basis of all foods marketed to children under the age of 2, with a carve out for infant formula. Effective January 1, 2025, all of these test results on a lot-based basis have to be made publicly available on brand websites. So this way, parents and caregivers, really through transparency as a conduit to accountability, that parents have an opportunity to pop the hood, kick the tires, and actually see what exactly, when it comes to heavy metals, is in America's best-selling baby foods. So it's one where it's the first of its kind. It's one where there has been a series of different types of federal regulations that have been at play and in the process of being implemented for several years. Several years ago, within the world of baby food, there was a congressional investigation that looked at the levels of heavy metals in America's top-selling baby foods. It subsequently resulted in a closer to zero efforts by the FDA in order to kind of figure out how can we preserve nutritional density as well as reduce the overall heavy metal impact burden when it comes to America's children. But right now, in terms of laws that have, require transparency of those test results, state of California is the only one that haven't implemented. Maryland actually has one on deck. As many of you that are attending today may remember the series of kind of coverage that had taken place. A law was passed in Maryland called Rudy's Law, as coming after the impact of lead poisoning on a child who was consuming certain quantities of the applesauce with contaminated cinnamon. So along those lines, there's different series of exposés and exposures have resulted in different federal as well as state policies.
So this is, obviously a big leap forward, and California is often on the cutting edge of new environmental regulations that others follow. And you expressed concern about what might happen to the rejected lots of baby food that does not pass muster. So can you
Yes,
talk a bit about
you're
that?
correct, Angela. So one of the things you always have to think about is kind of like this. You can imagine you've got baby food brands that are looking to source good, healthy, nutritionally dense ingredients, and in the process of doing so, not every incoming load, not every lot, not every batch or every ingredient that happens to come in is going to pass muster. Some of those, and hopefully they will be actively rejected, so they are not introduced into the baby food supply. And therein lies the question. What I know is that high quality and nutritious baby foods are going to come from high quality nutritious ingredients. High quality nutritious ingredients with low heavy metals come from good healthy soils, and good healthy soils are the byproduct of good environmental policy. But the reality is, if you have a brand that says, I'm not satisfied within this ingredient, well, where does that ingredient go? It doesn't mean that it necessarily turns into livestock feed. It very much can be redistributed through the supply chain back to unsuspecting brands or countries that don't necessarily have that same level of rigor and oversight when it comes to mandatory testing, especially for foods that are going to be ultimately marketed to vulnerable populations.
It's a very important thing for us to keep our eye on somehow. So a slightly different topic. You recently co-authored a paper on heavy metals in prenatal vitamins, which I've been waiting for this paper for 3 years, and I'm excited that it's out. So can you brief us on the findings?
Yes, it's very
Disturbing
exciting.
findings.
It was just published the other day. We haven't exactly figured out all the ways that we're going to look to
Yes, so another breaking
promote it
news
as well.
here.
But it's when it comes to prenatal vitamins, here's the reality: is that mothers and mothers to be reach for prenatal vitamins before they get pregnant, while they get pregnant, and after they get pregnant, in order making sure themselves as well as their baby gets all those essential vitamins and nutrients. You think about core nutrients like folic acid, methylfolate, that are essential to protect from neural tube defects. In fact, there are studies that show that the compliance in terms of pregnant women taking prenatal vitamins is nearly twice as high as compliance with taking antibiotics. That it's one where, at least speaking for myself, I know that I was pregnant, independent of how you feel, so that you just feel this sense of relief by knowing if I take that prenatal vitamin, I'm going to get my child, my unborn baby is going to get all the vitamins and nutrients they need to be able to grow healthy while still in the womb. So for us, it's one where it's interesting because when you think about prenatal vitamins, it's one where, yes, vitamins are supplements, but because of their potential to protect from neural tube defects, they're more than that. At least for me and consumers, they are more than that. The other reality is that you have to look at the inextricable link between the health of mother and the health of child. You also have to look at is that heavy metals can cross that blood barrier, that placenta barrier. And if mom doesn't have the necessary reserves of things like zinc and iron, heavy metals like lead, cadmium, arsenic, mercury also have that potential of being absorbed into the womb. That's why we hear different things on studies that show pregnant women shouldn't eat too much seafood because of the potential for mercury absorption. Same thing applies here. Within looking at prenatal vitamins, that was one of the things that was really startling for us, is that we saw absolutely certain prenatal vitamins and certain folic acid, methylfolate, that had very low levels of heavy metals. And on the other side, we saw some that actually had in parts per million. Typically, when we test for heavy metals, you're looking at parts per billion levels. We saw a handful of products that actually in the parts per million. It's a matter for us when it comes to brands to proactively, like we talked about, proactively formulate differently, knowing that this heavy metals is not only a public health threat, it's also increasing in consumer awareness and concern. It's a matter of aligning that true north with what consumers want, voluntarily thinking about food safety differently for my health of my family as well as yours.
And what was the stat of the percentage that of products you tested that had high levels of metals?
So the thing is to kind of put it in perspective, it was one where, high levels is kind of a relative term, but it's ones where there was probably only a handful with the levels of heavy metals in the parts per million category, but there were, over 50% that would be in one serving, potentially violating California Proposition 65. That if you look at it as high rate of compliance, high rate of adoption of taking prenatal vitamins, knowing that moms are going to be taking one a day, in this case, and taking one serving a day, do they have the potential to violate the laws that are on the books?
Okay, and the link to Jackie's paper is in the chat, so people can click on that and find out more. So last question, Jackie. So are there prenatal vitamins that are clean label certified? And where can we find information about what's safe to buy? Go ahead and plug your website and your
Yeah, I appreciate it.
reports.
Thank you so much. Yes, there are plenty of really great brands that have Clean Label Project certified, that are Clean Label Project certified. Check out our website, cleanlabelproject.org. And in general, for parents, caregivers, moms to be, obviously the thing is, take prenatal vitamins. They are essential to making sure that you have a good, healthy pregnancy with a good, healthy child. The biggest thing is that in all categories, whether you're looking at prenatal vitamins, food for your family, any of your family staples that are in the refrigerator or pantry, the thing is to be a conscious consumer, ask questions, demand answers, knowing especially that right now when we look at heavy metals, this is currently things that are typically outside of the scope of federal regulation. It's about especially moms serving as that chief operating officer of their households and really serving as that arbiter of what should end up on pantries, refrigerators, and medicine cabinets in America.